Hi, I'm Josh Ratner, and welcome to HealthAlliance You, a health and wellness series brought to you by HealthAlliance of the Hudson Valley. Peripheral vascular disease, commonly referred to as PVD, affects roughly 8 million Americans, and most commonly occurs in the arteries of your legs and pelvis. Left untreated, PVD can cause serious damage to your limbs and cause additional health problems to occur. Dr. Jeffrey Hnath, Medical Director of Vascular Surgery at HealthAlliance, is here to discuss PVD and how to prevent it.
PVD, otherwise known as peripheral vascular disease, is hardening the arteries, specifically arteries that are not associated with the heart. You get buildup of plaque, and when it happens in the heart, people get heart attacks, but when it happens in legs or other vessels, it causes problems to those associated organs, such as the legs specifically. So symptoms are insidious. They tend to sneak up on people. For a very mild case, the blood doesn't get to the legs appropriately when people are exercising. So when they're at rest, they don't have any pain. However, when they begin to walk, they develop pain in the calves. And this pain resolves when they sit down and rest. It's just a matter of the muscles needing blood that they don't get during exercise. And basically they scream in pain and it hurts. As the symptoms worsen and people have more blockages in their legs, they develop pain all the time, specifically in their feet when they're sleeping. And the reason for that is when the legs are flat and not in a dependent position, they don't have the assistance of gravity to help with flow to the toes, resulting in pain. And as an extreme, sometimes people can get wounds or in their feet that don't want to heal appropriately. Little nicks in the skin that normally would heal in about a day or two, they can stay open and non-healing for months without the proper blood supply. It's a result of a couple of medical problems, basically forming a perfect storm. So people can have diabetes, hypertension, high cholesterol, but really the big issue is tobacco use, causing hardening of the arteries. And sometimes there's also a genetic link. There'll be whole families where people have these kinds of problems. The diagnosis starts with a good history, asking the right questions. Asking, do your legs hurt? Do your feet hurt? Do you have wounds that are present that maybe shouldn't be there? It's not normal to have pain in the legs. And then after that, it's a physical exam. You're supposed to have pulses in your feet. You're supposed to be able to feel pulses. If you don't, then usually it means there's something wrong. And those are really the two main ways to find out if you have PVD. The worst result of having bad peripheral vascular disease could be limb loss. You can lose a leg, you lose toes to amputation. Fortunately, if PVD is caught early, we can treat it first by treating hypertension, diabetes, stopping using tobacco, and using cholesterol medications, just a risk factor modification. And a lot of times that's enough to make the pain get better. For more severe cases, there's ways to fix the arteries themselves. At HealthAlliance here, we recently received the Joint Commission accreditation for vascular disease and vascular surgery. And we're one of the few hospitals in the country to do that. And we were able to get that recognition by having a complete service line. The best way to prevent PVD from being caught too late, so to speak, is to pay attention to their own bodies. It's not normal to have pain, and pain is one of the big issues. It's also not normal to have numbness or lack of feeling in a toe or a finger. So simple things like that. It's a lot of common sense, but these symptoms do sneak up on people. They don't realize over the course of months that this is happening. So you're supposed to be able to feel pulses in your feet, you're supposed to be able to feel your feet, and you're supposed to be able to walk without pain.
We hope you, the viewers, found this edition helpful in providing details about peripheral vascular disease. Remember, it only takes a few lifestyle changes to help prevent PVD. For more health information or to view this episode again, visit us at hahv.org. Join us next time for another segment of HealthAlliance You for details on how to stay healthy.